Hello, my name is Dr. Diane Williams. I'm a teaching professor and associate director of undergraduate studies in the School of Public Health and Health Systems, which is part of the Applied Health Sciences faculty at the University of Waterloo. I have the privilege of teaching students who have a passion for improving human health from first year all the way up to the fourth. And I always marvel at the growth and achievements in students as they progress through the two undergraduate programs in which I teach. I feel lucky to be a part of the Applied Health Sciences faculty, which emphasizes solving complex health issues from many different perspectives. So I'm going to talk about the public health program at the University of Waterloo. But I'm going to start off with what the definition of public health is. It's the science and art of preventing disease, prolonging life, and promoting health through organized efforts and informed choices of society, organizations, public and private, communities, and individuals. The focus is on improving health and quality of life of individuals and populations through prevention and treatment of disease and other physical and mental health conditions. It includes health promotion, which is enabling people to increase control over their health and its determinants, and thereby improving health. This program is for students who are passionate about ideas like social justice and community development and engagement, and educating people around health as well as preventing disease at a population level. This picture is of Rohit, one of our graduates, who followed his passion for public health after graduating, starting with completing an internship at the World Health Organization in India. He is the founder and CEO of a consulting firm called Antara Global Health Advisors that provides evidence-based public health expertise to Fortune 500 companies, NGOs, and governments. Rohit is also the public health advisor and principal investigator at Cola Life, and the primary investigator for an exciting new trial working to improve child mortality in remote African communities. The nonprofit organization is testing to what extent piggybacking anti-diarrheal AirPod kits on Coca-Cola's extensive distribution network can improve access to life-saving treatments for diarrhea. Rohit also teaches a small seminar course called Global Health Innovations for our students interested in global health. So why do we take this approach to address systemic barriers to health? Well, let's look at a case study. The example of malaria in sub-Saharan Africa. Malaria is an incredibly complex problem. It creates substantial costs to individuals and governments. Most of the effective solutions have little to do with traditional medical interventions, and it's a leading cause of death, particularly among young children. And so why do we take this approach? Well, there's a very efficient mosquito that's responsible for high transmission of this disease, which is actually caused by a parasite from human to human. Weather conditions such as rainy seasons allow for transmission all year round, and there are quite limited resources, and socioeconomic stability in some of these countries lessens the effect of malaria control efforts. So what can be done to tackle this very complex health problem? Well, a public health approach is the most effective way to address the problem. And it can include approaches like spraying insecticides and providing bed net interventions to try to cut down on people getting bitten by mosquitoes. It includes eliminating mosquito breeding sites by removing standing water, for example. Also includes educating community members on malaria and its prevention. And then finally, ensuring that health clinics are accessible and sustainable with local staff. And even at the clinics, access is an issue impacted by social determinants. And this is true for many health issues, and why our courses focus on looking at how to address the problem from a variety of angles. So let's break down these different approaches to tackle the global health problem of malaria. So first, we have to think about how to prevent people from getting sick in the first place. It's important to understand social conditions that can lead to disease spreading more rapidly. Are there people at increased risk from living in crowded conditions or in areas without good health infrastructure to handle people who are sick? It's important to understand how ecological determinants like global warming or habitat destruction have contributed to further spread of mosquitoes to more temperate regions of the world and increased transmission of malaria from human to human. Government policies can also play a huge role in these situations. Can people afford to stay home if they're sick? Is there enough funding of the public health infrastructure to be able to test and treat people suffering from malaria? So many of the courses our students take in the curriculum allow them to understand these different perspectives. Our public health students also learn about the biological determinants of health, including how the malaria parasite is transmitted and its effect on the human body to cause the severe symptoms like fever, nausea, and vomiting. So our students take courses to help them understand human biology and physiology. This is not a Bachelor of Science degree, but again, students do get a basic understanding of the public health preventative measures and how to apply them, thinking about how the human body works. There are also lots of free electives, 13 of them, to take additional science courses for those students who are interested. In many cases, behavior also plays an important role in transmissions of diseases like malaria. Do people feel empowered and have the knowledge to understand the problem of malaria in their communities and do something about it? Do people believe their efforts in mosquito control, such as removing standing water and using insecticide-treated bed nets, will make a difference? How do we convince people to change their behaviors? Well, beyond behaviors around transmission of infectious diseases like malaria, the leading causes of death worldwide are chronic diseases like cancer, diabetes, and heart disease. In many cases, there are behaviors that can be modified to lower the risk of getting these chronic diseases. For example, the connection between smoking and lung cancer and cardiovascular disease. These are just some of the courses students can take to better understand human behavior and how to use health promotion techniques like education, social marketing, community engagement, and empowerment to encourage the adoption of healthier behaviors. In addition, our students learn how to use the most effective health research methods with various courses from health informatics to epidemiology to qualitative and quantitative approaches to health and statistics. Anyone working in the healthcare industry, from professionals to researchers, must understand how health information is generated. We have an advantage here at Waterloo. The School of Public Health and Health Systems has substantial expertise in using information technology to improve healthcare service delivery. Students are exposed to this field, giving them an edge over the next 10 to 20 years as the healthcare industry changes due to advances in technology. In addition, students can enroll in the health informatics option, which combines courses in computer science with information management and health sciences. Students need to be able to assess the legitimacy of new health research findings, and they receive an excellent background for graduate studies and highly sought-after skills in statistics and health informatics and health research methods that employers are looking for, including co-op employers. Students can also specialize by enrolling in health research specialization, which includes doing a fourth-year honors thesis. Another example where a multidisciplinary approach is important is with the COVID-19 epidemic. Maybe you've heard of it. Although we need scientists to try to find a biomedical approach, for example, effective vaccine and treatment for the coronavirus, right now the focus is trying to reduce the spread of it through public health measures. Governments need advice from experts in public health to make far-reaching decisions about things like closing schools, regulations on social distancing, how to protect the most vulnerable people, and how to ensure that vital supplies like personal protective equipment can be made available to the frontline healthcare workers in our healthcare system. At Waterloo, the School of Public Health and Health Systems offers 2 degree programs, a Bachelor of Science and Health Studies and the Bachelor of Public Health. Students in both programs gain an understanding of how all factors, from physiology to sociology to psychology and public policy, influence human health and well-being. Health Studies is for students interested in positively impacting the health of individuals and communities through clinical health or scientific research and have a strong foundation in natural sciences. The rectangle in the image represents how health studies courses cover all factors influencing human health evenly from cell to society. Public health is for students interested in positively impacting the health of individuals and communities through change based on human rights and equality of opportunity, or social justice, and desires skills in advocacy, mediation, and empowerment, and is represented by the darker teal, just focusing on human health at the biological level, and going into more depth at the individual and population health level. Now that you have a better idea of the breadth of topics covered in the public health program, I'd like to share some information about what experiences you might have as a Waterloo Public Health student. So this figure shows what your schedule would look like in first year. Students have between 15 and 20 hours of class per week. and approximately 40 hours total when you figure in both class time, tutorials, readings, assignments, and studying. The schedule is unique for each student, and as you can see, there are electives available right in first year. A sample schedule can be found in the Public Health Program brochure, which I'll share a link to at the end of this video. So our students have many opportunities to learn by doing. There are interactive classes where students study real-world examples, including in their tutorials, in introductory health courses, in seminar courses, and in community learning projects. There are also more than 30 specialized upper year elective health courses in which faculty are able to teach courses that they're passionate about that involve their research. Some examples would include advanced social determinants of health and gender, sex, and health. So this photo is from the Advanced Social Determinants of Health taught by Dr. Kelly Anthony. And it's a course that involves field trips to community locations to see where people access various supports, such as soup kitchens and safe injection sites. So in our introductory health courses, Health 101 and 102, students have tutorials where there are only 25 to 30 students in the class. And in these tutorials, students will discuss contemporary health issues, they debate different positions, they do role-playing exercises, and practice critical thinking. So some example of content that's covered in the tutorials would include infectious diseases of major global health impact, such as Ebola virus disease, HIV, and the SARS-CoV-2 virus, which will be a topic of tutorials this fall. They also will discuss public policy issues such as, should the government put taxes on sugar-sweetened beverages, or should there be regulations on marketing of vaping products to make them less appealing to youth? Students might discuss the pros and cons of different approaches to tackling the opioid epidemic, and in other tutorials they might learn about how stress affects the body and learn stress management techniques. In Health 102 tutorials, one of the student assignments was to take a position on a public policy issue important for human health, such as stricter regulations around the way vaping products are marketed, with flavors like strawberry shortcake and pancake man, in order to try to reduce their appeal to youth. Students must then write a position paper that defines the underlying public health issue, discuss policy objectives, as well as alternative to the policy, and then spend tutorial time debating and defending their position with their peers in small groups. So students get the benefit of learning about important public health issues directly from experts doing research in this area. Students also have lots of opportunities to learn by doing, with health-related volunteer opportunities on and off campus. Health studies and public health students can volunteer outside the classroom to gain even more practical skills. For example, they can help clients with cancer recover from treatment through exercise. They can run peer-to-peer health promotion campaigns through health services. They can buddy up with students wanting to benefit from physical activity, or they can mentor first-year students. This photo is of Natalie, a public health student who volunteered with the Peer Health Education program here on campus. Students have the opportunity to learn by doing by carrying out research supervised by our amazing faculty. Here's an interesting statistic. The Applied Health Sciences faculty, which is one of the smaller faculties on campus, actually has the second highest level of research funding per faculty member at the University of Waterloo. That means that there's lots of research assistant opportunities for our undergraduate students through either co-op, volunteering, or through paid jobs as a research assistant. The list on the screen is representative of just a few of the many research groups housed in the Applied Health Sciences in which students can get involved. The professors in the photo are Dr. David Hammond and Dr. Scott Leatherdale. Both trade off teaching Health 102 every other year. They are two of the top public health researchers in the country. Each are applied public health chairs with the Canadian Institutes for Health Research and have received over $1 million in funding. Scott Leatherdale leads COMPASS, the world's largest and most comprehensive longitudinal study of youth, focused on developing programs and policies to reduce the future cancer burden in Canada. I will share a link so you can learn more about his research in the YouTube video description. Dave Hammond investigates the use of e-cigarettes as smoking cessation aids, nutritional labeling, caffeinated energy drinks, and medical marijuana use among Canadians. Students also have the opportunity to learn by doing in the co-op program. Waterloo is home to North America's largest cooperative education program. Co-op is one of the many ways to build your resume and gain experience during your time here at Waterloo. Co-op offers students the opportunity to gain 20 months of paid work experience. The employment rate from 2018 was 94%. In public health, you have a choice of two great ways to study, regular or co-op. Both are great options. Choosing the right one depends on your particular interests and goals. Regular provides a traditional university experience. You complete your degree in 4 years and have your summers off. This provides you with the opportunity to plan your own summer jobs, projects, or other activities. It also provides you with the continuity in your studies and living arrangements and a faster path to graduation. For students in the regular stream, Waterloo offers the EDGE Experiential Learning Certificate to improve your career skills and market yourself to employers. On the other hand, co-op is a 5-year program in which students alternate between work and study throughout the course of their degree. The academic component of the program is exactly the same, just with 20 months of paid work experience built in. Co-op does require extra work and dedication, as students have to write resumes, cover letters, and go to interviews. But in the end, they will earn a Waterloo degree. We have a whole department here at the university dedicated to helping students along the way. This chart provides you with a breakdown of how your study paths differ with the two options. Either way, it's the same 8 semesters of study terms taking courses on campus. In the co-op stream, students start alternating 4 months of study with 4 months of work starting in their second year. If you are interested in co-op, Waterloo can offer you several key advantages. We have North America's largest cooperative education system with connections to over 7,000 employers who have signed on to hire our students. Students can search our online databases to find employment opportunities in their field or use their own existing connections to find a position. You can try something different each work term or return to previous employers. It's a competitive process, so students actively apply for the positions they are interested in. We have lots of resources to assist students with this, such as mock interviews, resume critiques, and more. These are some examples of co-op jobs that our students have done in the public health program. Common employment settings include clinical settings, such as at hospitals, conducting research either on campus or off campus, working in regional, provincial, or national branches of government, such as a local public health unit or the Public Health Agency of Canada, or working in a nonprofit like the Canadian Heart and Stroke Foundation. Students can also work in health and safety roles for large corporations. Pictured above is public health student Julian. During her first work term, she worked for the Human Resource Department at an engineering firm, and she developed a website for employees on health and wellness. During her second work term, she worked right here on campus for counseling and psychological services. She learned more about mental health and helped students through the intake process. Her most recent work terms were for the Public Health Agency of Canada. For students who pursue the regular program, there are still many ways to grow as a professional at Waterloo. The EDGE program is a free, opt-in program that aids in student professional development and will help you develop your professional skills, explore career options, and learn how to market yourself to employers. And some of our own health courses qualify as experiential learning courses, such as the Community Learning Project course. Students also have many options to customize their degree. They can adopt specializations within the School of Public Health and Health Systems, such as a gerontology minor or a health informatics option, or they can specialize outside of the program. So they could do a minor in psychology, for example. This photo is of Rachel Thompson, a graduate of our program who started her own enterprise creating books for older adults with cognitive impairments. Specializing in aging with a gerontology minor is a great option and is certainly useful in clinical settings where 80% of patient billing is for older adults. So this is a very relevant minor for future career paths. Students also have the opportunity to customize their degree by applying to an accelerated master's. It's available to public health and health studies students planning to pursue a master's degree in the School of Public Health and Health Systems. They have options for a Master of Science, Master of Public Health, Master of Health Informatics, and Master of Health Evaluation. When students are accepted into the accelerated masters, then they can work ahead and take master's courses while they're still undergraduate students. This slide shows some of the career paths of our public health graduates. About 40% go on to professional or graduate programs such as in public health, occupational therapy, and mental health and addictions. and about 56% go on and start a career right away. There are many different ways to help others and make a significant impact on human health. Waterloo Public Health was designed to meet the growing need for public health professionals. Graduates from our program have been landing careers working for health-related nonprofits, government organizations, community support programs, and working in the business industry. We are seeing quite a few land careers for health technology companies because they understand how to apply technology to the entire population to benefit health. The career examples you see are from our graduate statistics survey, which surveys students who are within 1 year of finishing our program. I hope this information has helped you to understand how Waterloo approaches public health and the types of opportunities we offer our students. If you are interested in learning more about admission requirements, please use the first link shown above. You can view an electronic copy of our public health brochure that lists all the courses we offer through the degree by visiting the next link. If you've already applied, you might be wondering about your next steps. We will continue to make offers until our final round of admissions in mid-May. You can learn more about life on campus, and if you're interested in joining us at Waterloo, make sure you accept your offer by the deadline and submit the residence community ranking form and deposit if you plan to live in one of our on-campus residences. Thank you for taking the time to watch this video.